Hello friends, in this video we will talk about evidence-based medicine. So this is the topic which is not related only to gynecology or obstetrics. It's related to a medicine as well. Okay, so what is evidence-based medicine? First of all, this word was coined by Gordon Guyatt around 1990. What was happening before this EBM, that is evidence based medicine, came? The doctors, the clinicians, and the physicians and the surgeons were following traditional treatment described by renowned authors of renowned books, or the treatments described by various known surgeons and physicians. The juniors were following exactly how the seniors were doing. Okay, so from where the juniors were learning how the seniors were doing some surgery, or how his senior or how the head of that department was doing the treatment of some particular disease. The junior or the trainee who is taking training under that particular professor or that particular head of department will be following that kind of treatment. So this was followed before EBM. But what happened after EBM? At that time, before EBM, personal treatments were copied and followed. The importance of expert opinion was well higher. Expert opinion was given a very good importance. That doesn't mean that research work was not doing that, was not done at that time. Research was also done at that time, but the importance to that research work was not given properly. Research work was taken as just a side opinion and not the very basic a pillar of treatment. Let's take an example. Pyrazinamide, the pyrazinamide, a TB drug, is generally considered unsafe in pregnancy, and the people were actually not taking this drug because it was called as a unsafe. Then the high-end clinical trials were done with the use of pyrazinamide, and what we found is there are definitely side effects, but there are not that much side effects uh, compared to the advantage. When the TB infection is on higher side, when the TB is not controlled by isoniazid and rifampicin only, you need to use pyrazinamide because the advantage outweighs the risk. So now people are using pyrazinamide, but with known risk. So this kind of precision in usage of drugs and medicines and the different treatments is now very uh, precise with the help of clinical trials, high end randomized clinical trials, well controlled clinical trials. So this thing, particularly the trials, are now the main thing of evidence based medicine. For example, importance of expert opinion just goes down. Now the importance of that expert opinion is not that much. What is important now? Randomized clinical trials. And why these randomized clinical trials become popular, and why it was not followed before? Because with the evolution of information technology, and with the evaluation of statistics, population statistics, research population statistics, the the subject of biostatistics just came out. For example, there is a population of some 10 lakh, and you just need to know the prevalence of tuberculosis in that 10 lakh people. So there are very precise methods of sampling that 10 lakh population. You just sample some of the person of that 10 lakh people, so you can exactly get idea that that the prevalence of that tuberculosis in those 10 lakh peoples. So what I am trying to say is the biostatistics has so much improved that it can actually uh, 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 um, help us to make decision that whether some particular drug or treatment is useful or not, and if it is useful, then at how much extent it is useful. Now the meta-analysis, the concurrent studies, everything is there. Everybody, every single clinician or every single person which is involved in medicine can have their own research papers. And those research papers and those clinical trials, those clinical studies can be used for higher generalization of clinical trials. So this means, so what I mean is randomized clinical trial, well controlled, after removing as much as biases, the result of those RCTs are now considered as the highest evidence for treatment. Okay, so before, the research work was taken as a side opinion. Now the research thing came to the bedside and not the expert opinion. So now we treat the patient. Now we choice of treatment is based on randomized control trials and not on the basis of expert opinions. So this is evidence-based medicine. People now follow and will follow evidence-based medicine. So this thing, I was thinking this very basic thing should be there into your mind when you are just entering the medicine. Before, in the second year, in the third year of undergraduation, you have different kind of imaginary treatments from your professors, and you have question in your mind that why should we treat why should we choose this treatment over this, just because that professor is telling you. No, it's not on that, it's on the evidence based medicine. Also it will help you to get that kind of attitude uh, in your future medicine life, when you will become a real surgeon or physician. You will also have that kind of attitude needed for evidence based medicine. Thank you, friends.